It started as a little burn after a big meal, nothing a quick antacid couldn't fix. But then weeks turned into months, and what seemed harmless grew into something much bigger. For millions of people, heartburn is just the tip of the iceberg, a warning sign of deeper troubling brewing beneath the surface. Today we're going to follow Sarah's journey, from brushing off her symptoms to confronting serious diagnoses like Eosinophilic esophagitis or Barrett's esophagus. We'll talk about how once a miracle pill like Omeprazole changed the way we treat acid reflux and why it's not a cure-all. And most importantly, we'll explore how real healing goes far beyond managing symptoms. Before we dive into Sarah's journey today, I want to invite you to take your own health journey even deeper. If you're ready to move past surface solutions and really understand the why behind symptoms like heartburn, check out the Feel Better, Feel Great podcast membership. It's where we break down complex issues into clear, actionable steps that you can actually use. And I'll tell you a little more about it in the show, but if you're curious, the link is in the show notes.
Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
Hello and welcome to the Feel Better, Feel Great podcast. Episode 164, Heartburn Help, Navigating Acid Reflux. In each episode, we dive into the wonders of holistic health and functional medicine to empower you with the knowledge you need to lead a healthier, happier life. I'm your host, Dr. Andrea McSwain, and you'll also hear today from Nurse Rochelle, our podcast producer. Please remember that the information provided in the podcast is for educational purposes only. Please seek the advice of your medical professional with any questions you may have regarding a condition or health objectives. If you're new to me, please like, subscribe, and click the bell for this channel. So let me introduce Sarah. She's our patient. She's like a 36-year-old professional with kids and married. She's vibrant, but she's increasingly bothered by chronic heartburn. So chronic means it's been going on for more than 6 months. It started after stressful work days and spicy dinners and maybe a beer a little late in the evening. She initially brushed it off, but then she started popping over-the-counter antacids regularly. Now, at first, she's thinking it's just a nuance, but this is the first problem that we're told to think, actually, is that, oh, just take an antacid, you'll be fine. That is a misconception, okay? The having heartburn is not a nuance, it's a warning sign. You might be recognizing yourself or someone you love in Sarah's story. I want to explain a little bit more about acid reflux. So it's acid reflux, right? It's a reflux of acid. So that's really important. Acid is supposed to be in our stomach because acid, which is a very low pH, is designed to help break down our food. It's designed to kill pathogens like bacteria that are in our food. And it's designed as one of our really critical immune system steps in the digestive process. As I might reference you to episode 104, which is gut tube health, just kind of understanding what the gut tube looks like from beginning to end. So when you put acid in the middle of that system, it's really designed for a reason. However, there can be some miscalibration that happens when stomach acid moves upward. And when it's outside of the stomach, acid is very irritating, especially irritating to the esophagus. And some people will argue that this is also a weakening of the lower esophageal sphincter, and that is a valve between the esophagus and the stomach. So this particular valve gets weakened and then acid will shoot up. Now, I argue with that a little bit because that would require a lot of anti-gravity. But what happens though is a little bit of acid goes a long way in a tissue that's not designed to have acid on it. Okay, and that can then aggravate more of the tissue. So we might feel heartburn, right? So you might feel that burning in the middle of your chest. You might have a regurgitation. You can have chest pain and definitely throat irritation. Again, acid is going to be alarming to the system, and wherever it goes locally, it's going to be aggravating, and that aggravation can also radiate. So you might start feeling different symptoms. So Sarah started waking up coughing at night. And that was when she was laying fairly flat with a pillow, and then that aggravation of the acid going into her esophagus was then causing her to cough. And then she started feeling a lump in her throat sensation. Really globular feeling, very thick, very aggravated because the tissue is swollen now. So these are the things to think about understanding acid reflux. One, we need acid there. Two, when acid goes to any other tissue outside the stomach, it's going to be really aggravating.
So I feel like a lot of people think that GERD usually is like too much acid. But how often would you say that it's more about acid being in the wrong place or a more mechanical issue?
Yeah, I don't think it's more acid at all. I think that's, I'm glad that you asked that question because, because I spent a lot of time thinking about this a long time ago, and then now it's kind of, I lose some of those layers that are critical to understanding what's going on. It's not an overproduction of acid. In fact, you're absolutely right, Rochelle, because when you think it's an acid overproduction, then you're going to get into these medications that reduce the acid production, either proton pump inhibitors or H2 blockers. They're both saying pretty much the same thing. But the idea there is let's reduce the amount of acid. And that is a bigger problem. So when you realize that, which we'll talk about in a minute, you realize why you need to fix what you have going on right now. Well, Sarah found that, and her tipping point was really after months, her symptoms kept escalating. She kept losing her voice, having difficulty swallowing certain foods. She felt very aggravated. She was very uncomfortable. She couldn't really sleep it well at night because she couldn't really lay in a position that she could get comfortable because the reflux was coming on at night. And at first she tried to soothe this with more eating because she thought, okay, well that will, because there's extra acid, right? To your point, it's probably what she was thinking. Yep. I'll add more food so then it will the acid will have something to do. Well, that's not exactly it. She talked to her primary care doctor. A lot of primary care doctors are going to directly refer to a gastroenterologist. And then so she went to that. Of course, when you're told to go see a specialist, you think it's a problem. But if you're not told to take some dietary measures, to take some lifestyle modifications, you don't really know how severe is this, right? Especially if it's going on more than 6 months. Oftentimes a primary care doctor is going to refer you out. So you're going to see a gastroenterologist. They're going to say, hey, to them, not a really big deal. Let's get you started on some medication to block that acid, right? Proton pump inhibitor. Start omeprazole. Omeprazole is one of the most popular drugs ever prescribed, which is remarkable. So we know this is a really big problem. So here comes a PPI, right? And I remember watching a commercial because this went to over the counter. And it was this commercial about this really harried woman, right? Kind of exactly what Sarah looked like. Mid-30s, she's stressed out, she's in a cubby at work, like a cubicle. She's got a meeting coming up in a handful of minutes. She's got to run down, take the elevator down, go get some street food. Somehow there's this very large chili dog that she decides that that's the only option she has. And then she stuffs all that food down her throat and chases it with a soda pop or some carbonated beverage. And then the action of the commercial starts, right? She's like, oh, you see, the colors are getting red. She's feeling like she's woozy. And then what happens? She opens up her drawer, takes out some medication, and now everything is calm. She's now able to go take and carry on with her harried life because she has solved her problems with this medication or this over-the-counter medication. And so that is frightening, right, at best. But that's not going to solve your problem. It might be what Sarah found to be immediate, but you can see, and if you listen to the story, there's so many things that would make your acid in your body, your digestive tract, get confused. And I think I outlined that a lot, not only in Gut Health 104, episode 104, but also I think there's another episode, and I'll get to that in a minute, that we talk a little about organ performance, and I highlight some of these things. If you're seeing a gastroenterologist, they're going to be really concerned about a few things. One is called eosinophilic esophagitis. That sounds like a big word, right? It's a chronic allergy/immune condition that's sometimes mistaken for GERD, but really I consider it the next step after GERD, because there's something going on. The immune system is starting to get involved more. So what could be considered a structural problem with GERD, with the valve, what could be considered a lifestyle problem with the reflux, and then I totally disagree about acid overproduction. Mm-hmm. But now the immune system has infiltrated the esophagus and inflamed it because of that. Now the immune system has said, I'm going to put special soldiers, which are eosinophils, into the esophagus to help protect the gut tube. However, that is more severe of a situation where symptoms can be food impaction, strictures, swallowing difficulties. Is this reversible? Yes. Okay, another name from this is Barrett's esophagus. And so, Dr. Barrett, thank you for your work. This was a long-term reflux, and we see cellular changes in the esophagus lining. So if you've heard either of those terms, first of all, know that they are reversible. There's work to be done, but they're reversible. Yes, Barrett's increases the risk of esophageal cancer. So does the eosinophilic esophagitis. They're the same thing. But most cases don't progress to that. However, it's very disruptive to your life. It can cause chronic laryngitis and asthma-like symptoms due to acid microaspiration. The list keeps stacking up for how the dysfunction keeps expanding.
Yeah. My throat is going closed just thinking about that. But I feel like a lot of doctors miss eosinophilic esophagitis. Is that because it shows up just like regular reflux, or do they just not check eosinophils for that?
Well, that's a very good point. You can find eosinophilia or elevated eosinophils in the blood work, right. And it's a special white blood cell. It's pretty obvious if you're checking and actually able to read that lab marker. Mm-hmm. And then a lot of people, I think, are just going to say, hey, let's call it GERD, let's call it reflux. Right. A gastroenterologist technically has to do a biopsy. Mm-hmm. But any gold standard is tissue biopsy. That doesn't mean it's necessarily in your best interest, and it doesn't mean you can't figure this out in some other ways and have some really strong clinical suspicions that if you have elevated eosinophils in your blood, mm-hmm. that you have reflux symptoms, you probably have some esophagitis, and we need to start working on this because now you've involved the immune system into your gastrointestinal problem. Right. But that's such a great point with that. And then, talking about omeprazole. So there really was an era of omeprazole. Some people might not realize that, but the era of omeprazole was both a savior and a setback, right? And as you're hearing, so much of what goes wrong with reflux, from inflammation to long-term cellular damage and immune involvement, comes back to the health of your gut lining and your digestive ecosystem. So if you haven't already listened to episode 121 of this podcast, I dive into how to improve organ performance. I dive into how to improve organ performance through gut health. And that episode is packed with simple steps you can take to strengthening your gut barrier, optimizing digestion, lowering inflammation. All of these are critical if you're dealing with acid reflux or its complications. And I think you'll like it. I've linked it in the show notes for you. So, no surprise, Sarah's doctor did prescribe omeprazole, a proton pump inhibitor. So that's going to reduce acid. Okay, we're going to lead to symptom relief. But now we've added another problem. PPIs work by blocking stomach acid production at the source. H2 blockers, hydrogen rate blockers, do something very similar. There are long-term consequences to blocking acid production for your stomach. Okay, there are long-term consequences to proton pump inhibitors. That includes bone health risk. If you've been using omeprazole for greater than 1 year, you're looking at a significant calcium absorption issue, leading to increased risk of fractures, especially the big ones, the hip, the spine, and also the wrist. So the bone health risks are really present with people who've been using omeprazole for a long time. Well, greater than a year. So a lot of people think that's not a long time. It can also cause magnesium deficiencies. That can cause muscle cramps and heart arrhythmias. That's really important. Also, gut microbiome disruptions, which can increase your risk for infections. Because when you block the acid from being made by taking a proton pump inhibitor and even H2 blocker, you are now very susceptible to infections because the acid is meant to kill these pathogens, and that risk can include C. diff. So C. difficile is a very significant pathogen causing a lot of problems for people, and people who take omeprazole at much higher risk. Also, there's a potential link to chronic kidney disease if you use this for a long time. Again, a long time means over a year. Sarah, of course, when I talked to her about these, she was grateful for the relief that she'd had with omeprazole, but alarmed at learning what these risks are.
Yeah, I think I actually had a conversation this weekend with a family member who was talking about how they're taking calcium because they're on a statin, but they've also been on omeprazole for more than 4 years. So that's a big indicator now, because I was kind of like, okay, but what else is going on? Like, it just seemed kind of random. So yeah, that is definitely something that I'm going to make sure they watch this just for that information alone, because that is really impactful, and I think a lot of people don't know that about PPIs, because I mean, they were kind of handed out like candy for like years. Like, that was like, oh, you got GERD, here you go. Like, that's what you get. Or yeah, take a Tums and you'll be fine, that kind of idea. And so I think this is that's really impactful to know, and for people to be able to take that step.
Yeah, it's remarkable how much this is just, like you said, like candy, and so, as you can tell, these issues go way beyond heartburn. We start looking at nutrient deficiencies and how this medication is called a drug mugger, right? It's stealing the other things you need to function in your body. And in our Feel Better, Feel Great membership, I dive even deeper into these topics like gut healing, nutrient absorption, strategies for safely tapering off long-term medications. Because fixing the root cause is often more complex than just taking a pill and then not taking a pill. So if this episode sparks some questions for you, I think you'll love the deeper dive we do inside the membership. Again, all the details are linked in the show notes. So what did we do for Sarah? Okay, we had to get her healing the root cause. So we looked at dietary changes, reducing food triggers, spicy, acidic, fatty acids, fatty foods that were highly inflammatory. Starting eating some small portion control with smaller meals, and then knowing when to stop eating, avoid eating late at night. Working on some tips I give in episode 104 and episode 121. Working on weight management, stress reduction, looking at some of the nutrient deficiencies and making sure that if they'd happen, that we started getting them replaced. And then looking at gut healing nutrients to actually address improving how she was absorbing and reducing inflammation in the gut. And then weaning off of PPIs. So some other medication options, definitely talking about betaine, talking about digestive enzymes. And then the goal here, I think, is to avoid endoscopy options, which is, having that tube and having that biopsy. I personally don't like that idea. I don't like when people have to repetitively have strictures removed. When you hear someone's coming back 2-3 times to have strictures removed and the inflammation's not being addressed, that esophagus is only going to get more scarred by the surgery and the strictures and more adhesed and more inflamed. So now you're looking at chicken egg problems when you start reducing strictures. Again, some of those things are more severe conditions that happen with GERD and with Barrett's and with esophagitis. So while we think that heartburn is common, it is not normal. Of course, early attention prevents severe complications, but it's never too late to get started, understand what's going on. And it's never too late to take control of your health, especially knowing that this is progressive and you do have to eat. So this is very progressive. Medications like PPIs and H2 blockers do not have a place, much less being used as a lifelong Band-Aid without addressing root causes. So I want you to, of course, listen to your body. If possible, seek early evaluation, but don't stop seeking evaluation. It's not too late. It's really important here. And then with any medication, think about risks and benefits. That's important. And that's too, being in the membership and being able to have a message board and have hot seats with me. These are great questions that we answer in the hot seats. So healing is a journey just like Sarah's. And each step towards digestive health is a win. If Sarah's story felt familiar, don't stop here. Healing your gut and reversing the damage of long-term reflux is possible, but it takes real knowledge and a clear plan. That's exactly why I created the Feel Better, Feel Great podcast membership to guide you with expert insights, advanced functional medicine tips, and simple steps you can start using today. Inside the membership, I just posted a gut healing starter plan that pairs perfectly with what we discussed today. You'll get exclusive access to deeper content, hot seat Q&As, and even personalized guidance. So come join me. It's a time to move beyond survival mode and start feeling great again. Thank you very much. Again, I hope that you enjoyed this podcast episode. Again, click share with families and friends, and we look forward to seeing you again next time.